Hi, I'm Dr. Tabatha, the functional gynecologist. I'm a board-certified OBGYN and functional medicine physician. I've embraced the world of functional medicine and wellness through my own personal health journey, and I'm super excited to share my wisdom and unique perspective as it pertains to women's health. So if you're struggling with hormone imbalance, weight gain, period issues, anxiety, insomnia, you name it, then you've come to the right place. I want to be your functional gynecologist. So welcome. Hi ladies, I'm super excited today to interview Dr. Anna Cabeca. She's an internationally acclaimed menopause and sexual health expert, a global speaker and pioneering promoter of women's health. She is an Emory University trained, triple board certified in obstetrics and gynecology, integrative medicine, anti-aging and regenerative medicine, and she's the author of The Hormone Fix, a diet and a holistic lifestyle program for menopausal women. Her areas of specialty include bioidentical hormone treatments, natural hormone balancing strategies. She's received extensive notoriety for her virtual transformational programs, which we're going to talk about, including Women's Restorative Health, Sexual CPR, and Magic Menopause. She created the successful and popular alkaline superfoods drink Mighty Maca Plus. It's delicious. She has a top-selling rejuvenating vulvar vaginal cream for women called Julva. In her spare time, she hosts the highly regarded podcast Couch Talk. She was named the 2018 Innovator of the Year by Mindshare. It's the #1 conference for health and wellness influencers, and she was also honored with the prestigious 2017 Alan P. Mintz Award, which is presented annually by the Age Management Medical Group to the most outstanding physician who displays clinical excellence and entrepreneurship. Dr. Cabeca has reached hundreds of thousands of women around the globe, inspiring them to reclaim their optimal health and realize they can journey through menopause and find more purpose and pleasure than they ever dreamed possible. She balances her passion for women's health with faith, grace, and skill while raising her 4 daughters and leading the nonprofit foundation she created in honor of her son, Garrett V. Bivens, who tragically died as a toddler. I know you're going to love her as much as I do. She's like the girlfriend's gynecologist. Without further ado, let's talk to her. All right. Well, welcome, Dr. Cabeca. How are you?
Great. Great to be here with you, Dr. Tabatha.
That is awesome. You guys, she is my idol. So she's a fellow OBGYN who kind of left conventional medicine for the world of integrative and functional medicine. And she is an amazing pioneer, like I mentioned before. So let's get your wisdom today. I'm super excited to have you here. And I really want you to share your story because I just think people are going to resonate with you having issues with infertility and, early menopause. Tell us about that. How was that?
Yeah, no, it was devastating. It was devastating. I was 39 years old. We had desperately desired to have another baby. And I was told I was infertile and in early menopause. And honestly, this, like, as a gynecologist, right? I trained at Emory and did a lot of reproductive endocrinology. Well, I failed the highest doses of injectable meds. I had 0 ovarian response, 1 dysfunctional cyst, and that was it.
Wow.
Ovaries were shriveled up, couldn't see them on ultrasound. It was really challenging. It was devastating. And we don't talk about that in medicine, about reversing infertility, right?
Yeah.
This is as kids, if you got shriveled up ovaries, you have shriveled up ovaries, right? That's
Yep.
it. Pause. Your numbers, your FSH and LH are high to the roof. That's it. It's not going to get better from here, right? But that honestly took me on a journey around the world because I was devastated and I knew that I needed to keep the earth moving under my feet.
I love that.
But what I realized, as the Buddhist saying goes, everywhere you go, there you are.
Yes.
Everywhere you go, there you are. But what I learned on this journey from meeting healers, indigenous healers to some of the world's leading scientists, and going to different clinics, and what I learned is that our body has a tremendous ability to rejuvenate, given the right tools. And already I'd been grounded in functional medicine, but there was so much more I needed to learn. And the fact that it really does take more than hormones to fix your hormones. And that's why I wrote the book, The Hormone Fix. But that's so
Yes.
true. As a result of this journey, I was able to conceive a healthy baby girl at age 41.
Yay.
53 with a soon to be 12-year-old. Yeah.
Uh,
So, uh,
that is so awesome. Good for you. I just think women need to hear that. They need to know that there's hope and there's ways to heal and reclaim your health, you know?
well, and as a result of that early menopause, I experienced all the menopausal symptoms, brain fog, tossing and turning at night, waking up at 3 a.m., covers on, covers off, one leg out, one leg in. I mean, it's that waking up and just feeling like, what's going on with my body? Hot, cold, irritable, cranky. Who is this person? And I went through all of that. And so, I don't know, maybe I missed that class in medical or residency.
I don't
I,
remember having that class either.
we both played hooky on that day.
Something.
But I will tell you this, because we're fellow OBGYNs talking. I was just at the South Atlantic OBGYN annual conference, and it was held in Asheville. And I was there because they were talking about, now they call it GSM, right? Genital urinary
Yes.
syndrome of menopause. In other words, vaginal atrophy, vulvar vaginal
Mm-hmm.
atrophy. And so I was disappointed. I was disappointed and heartbroken. Listen, I love, and this is really drove home the point. They call me the girlfriend doctor because we can have these conversations. You're a girlfriend doctor too,
Yeah,
right?
yeah.
Have these open conversations. But I looked around that room and I listened to what the conversations were and what the standard of care was and what medications were being prescribed and what surgeries were options. And, for vulvovaginal atrophy, their solution was estrogen. And again, estrogen throughout the rest of your life, good. Topical estrogen throughout the rest, great. But that is like, that research is still, we have 20 years of research in androgen therapy, vaginal therapy, hormonal therapies that go beyond estrogen. And, after that discussion, one of the physicians got up to speak. And it's interesting because I trained with her at Emory. And she said, I'm really frustrated because I'm writing Premarin vaginal cream to my patients, and it's $170 or something like that. It's outrageously expensive for these patients who are on Medicare, whatever. What are our options? And I'm thinking, well, first of all, I created Joel. I had to have something for me and just made it as economical as possible for women, 2 months for $60, right? But there was no mention of DHEA, no mention of testosterone, no mention of progesterone, and the pelvic floor has receptors for all these hormones. So the good news is the speakers were advocating vaginal health, for the rest of our lives. Don't just forget about it after menopause. But there's a lot more to the story, and that we're not getting it from our physicians. We're not getting it from our esteemed colleagues and academic institutions. And
Yeah.
it's really frustrating. We as women have to advocate for ourselves, and we have to understand what our options are and why they're,
It's so true. That I see that day in and day out in my office, just women struggling, and if they're even brave enough to talk about it, with their primaries, they're just kind of poo-pooed, and some luckily get to me. And then I ask about it, and there are so many other options. So I love your Julva product. It's an awesome cream that you can use. It's not the estrogen, so that it's not prescription either. So it's a lot cheaper, right? Because in Michigan, Premarin cream is like $300 for my patients. It's unbelievable. So, we do vaginal laser rejuvenation and things like that. But like you said, it's just not standardly accepted in our conventional community. And so patients miss out, unfortunately, by a lot of traditional OBGYNs. So I love that you're pushing for this movement.
Also, we're busy in the clinic. I mean, I've been a busy OBGYN,
Right.
right? We're busy in the clinic and we can't see the research. Now I look at all the research because I speak
It's
in
so
training.
true.
But one of the things I asked was also the new research, relatively new over the past few years, on progesterone receptors in the fascia. And that means the fascia of the pelvic floor. That's why we're more inclined to have prolapse, more inclined to have pelvic floor dysfunction, anal incontinence, urinary incontinence. We're also, like, the fascia is hormonally receptive.
Oh, that's incredible. It's incredible. And yeah, the majority of my patients are progesterone deficient. They come in, they're just chronically overstressed and they aren't producing any progesterone. And so, yeah, that makes total sense. So that leads me into your book, The Hormone Fix. Oh my gosh, it's been life-changing for me. So I honestly struggled to do the ketogenic diet. I didn't feel the greatest on it. And when I found your book and realized I can still eat amazing vegetables and greens and things like that and not have all these keto side effects, it was just life-changing. And I think women really need to know that what they put in their bodies has such a benefit on balancing their hormones. So explain to my listeners what the Keto-Green diet is, because I'm so excited for them to get this information and start changing their hormones and getting back into balance.
Yes, absolutely. Because again, right, it takes more than hormones to fix our hormones. And that's what
Yes.
I was able to, able to balance my hormones, become pregnant again, right at 41. And then I went into the second menopause at 48 with stress, post-trauma. I was mom and dad to my kids. And, as I was having brain fog, irritability. I mean, it was just, I was struggling.
Yeah.
And then I started gaining weight back. Now, listen, I've been over 100 pounds overweight. I've been over 240 pounds. And I'd lost that weight, lost the excess weight, kept it off for nearly a decade. And then it just started coming on overnight. And I don't know about you, Dr. Tabatha, you're more empathetic than I am, probably. So, patients would come in to me and say, well, Dr. Anna, I'm gaining 5, 10, 20 pounds and I'm not doing anything different. And then I'd be like, sure, you're not, right? Like,
Right.
you're doing something different, right? You're driving through, you're getting a Snickers bar. I don't know. Well, it happened to me. Like within a few weeks, almost like within the blink of an eye, I gained 20 pounds. It seemed like
Wow.
it. And legitimately, I was not doing anything different. And so here I was, struggling, no period in months, hot, cold, angry, irritable. I'm like, wait, I'm the mom to, like I'm the mom and dad to my girls. And one was in elementary, one was in middle, and one was in high school, teenagers.
Yeah, that's enough to do you in right there.
Right. I needed my wits about me, but I knew. So when I started gaining that weight, I'm like, I'm going keto. And I felt exactly like you did. I hit a wall. I felt irritable. I called it actually going keto crazy. I was on edge. There was no like peace to be found. And so that's when I just, from the functional medicine approach, started checking my urinary pH. And I was acidic, acidic, acidic. I was like, I was trying to figure out what's going on. So I pushed that acidity away, made my urine pH more alkaline by adding more greens, the low carbohydrate greens, hence my keto green plan.
Mm-hmm.
Again, staying away from the carbs, and but adding enough of them in the green format, low carbohydrate greens like kale, cabbage, broccoli, Brussels sprouts, cauliflower, beet greens, fabulous alkalinizer. We throw those away. I used to throw them away. They're so good, so rich and nourishing. So I started doing that and, improved my urinary pH and started to feel better. And I also noticed, this is really key because I talk about this in my book also, is that it's not just what we eat. The mornings I would walk on the beach, I would be alkaline easier all day.
Oh, wow.
All day. So that cortisol, bringing that cortisol down. So, I talk about this in the book, like starting with gratitude, changing our attitude, really looking on the positive and doing the things that we need to do that will make us happy, bring us pleasure, whether we feel like we deserve it or not.
Yes,
That,
yes. Oh my gosh. I wish all doctors would tell their patients that. It's just, we are mind, body, and spirit. We're a whole person. It's so important. It really does have an impact on our hormones. So I love that. So you have test kits, right? So people can check their urine pH and make sure they're alkaline when they're trying to do the keto diet. That's awesome. And do you do intermittent fasting with this? I was wondering.
yes, absolutely. And so I get people started on it in the Hormone Fix. And my book coming out May 5th, Cinco de Mayo, is called Keto-Green 16. So we push the 16-hour intermittent fast, as well as it's a 16-day plan with very hormone balancing recipes that will get us keto green pretty quickly. So the intermittent fasting is crucial. And especially this time period, over age 35, right? We see the progesterone levels decrease. Or you said progesterone insufficient. More and more of us are progesterone insufficient because this top hormone, as you know, is needed to make all our steroid hormones, DHEA and estrogen, testosterone, all of our sex hormones. And so that gets depleted. Estrogen starts to dip and decline with that sharp decline of progesterone. But what I didn't know till I tried to solve my own brain fog issue was that gluconeogen, so we either use glucose for fuel in the brain, for memory, clarity, energy, energized thought, right? We use glucose or ketones. Well, the use of glucose in the brain or gluconeogenesis in the brain is an estrogen dependent phenomenon that may account for why women have over 2 times as much Alzheimer's as men, but we have to shift the fuel. So think of glucose to gasoline as ketones are to jet fuel. And this perimenopause, when we lose the neuroprotective hormone progesterone and estrogen is declining, we have to shift. So there's the right way to do keto and there's the wrong way. Wrong way is keto dirty. The right way is keto clean, which is keto green.
Yeah, that's awesome. I tell all my patients that you got to do it keto clean, you got to do keto green. So that is wonderful. Yes. Another thing that I love that you're doing is your sexual CPR class or program online on your website. So tell us about that.
Yeah, definitely. And we'll give your audience a link to listen to my Help Doctor, My Sex Drive Has No Pulse.
I love that.
We'll give a free link for that, and we'll give you all a free trial for Jolva too. Just a small shipping and handling fee, but really want to get that in every woman's vanity. On every woman's vanity, Jolva is really so helpful.
Oh, that would be wonderful. Thank you.
You're welcome. It's so good. I would say it's for the lower lips, but you can also use some on the lips if anyone got those.
Okay.
I'm like, I saw those coming up. I'm like, I'm using Jolva. They went away. So my patients are always like, should have told me about that a long time ago.
That's awesome. Oh, I love it. Okay. So the sexual CPR.
Sexual CPR is a very holistic program that really works on the 7 key areas that can keep us from experiencing our sexy. So like getting our sexy back, feeling that self-confidence, feeling healthy and vibrant and passionate again, and increasing the intimacy in our relationships. The primary relationship in our life between husband and wife, as a partner, reestablishing that intimacy and connection, which can be broken down from many reasons. So I go through the key reasons that we can have a block to our sexuality, and especially again in perimenopause, menopause time period, 35 to 55, if we've had adverse childhood experiences, if we've had post-traumatic stress like I did, I've had both, that we tend to have a much more difficult time in this perimenopause, menopause. And it's almost like a flare up. We're in what I call a period of neuroendocrine vulnerability, anxiety, depression, mood swings, more neurologic symptoms, in addition to all the GYN symptoms that we can experience. So understanding, like kind of going through, I have a checklist and going through the areas that could be blocking us. It's very, very beneficial and healing. No matter how old we are, or how many times we thought we've dealt with something, it can be very, very healing. And then the medical, many women don't realize that antihistamines can decrease their orgasm and cause vaginal dryness, right? Or maybe their blood pressure medicine or their cholesterol medicine is decreasing their libido. Their birth control pills, right? So we talk about the different areas that could be inhibiting our own natural sex drive and, of course, relationship. And I interview John Gray. I also do who wrote Men Are From Mars, Women Are From Venus. I interview Dr. Jeffrey Life to do a men's sexual health because I get the women feeling 100% better, so they need to bring their men along.
Right, exactly.
And then just understanding our anatomy and our hormones as it pertains to our sexuality so that we feel it's very holistic. And it's a great name, Sexual CPR, so much fun, but it is not about porn. It is not about affairs. It is not about promiscuity. It's about wholly being in our sexy.
Oh, I love that. That's wonderful. Yeah, you hit on some major points. I see so many women who are, medicated. They're using Benadryl PM to get to sleep every night. They're on their blood pressure medicines, and then they're eating the standard American diet. And, they wonder why they're struggling and have no libido. So I think they should definitely check out your program because those are major points that they need to really address, for sure. I love that. Another thing I wanted to ask you about is your Mighty Maca Plus. So you hinted that you did this journey around the world trying to heal, and then this is where you found this, correct?
Yes, exactly.
Tell me about that.
Yeah, one of our first journeys was to Peru. And wherever you are in Peru, they say if you're not feeling well, take some maca. If you're tired, take maca. If your baby's not thriving, drink maca. If you're infertile, drink maca. And then they elbowed my husband and said, it's the Peruvian Viagra. So, of course we're drinking maca. But so, of course, as a scientist, I was a scientist before medical school, I wanted to understand why. So maca is, as most potatoes originate from South America, and specifically maca is specific to Peru and the Andes at very high altitude, typically above 10,000 feet. These tuber-like vegetables grow. They almost look like a turnip or, a beet.
Oh, okay.
So they're beautiful. And it's reported that the ancient Incan warriors would eat the maca before they went into battle to give them stamina, more energy, more, oomph.
Oh, wow.
And so, of course, I looked into the research. And maca, actually, they have specific proteins to maca called macaines. And it has a high concentration of arginine, which improves nitric oxide, which is so good for blood flow, right? And exactly how Viagra works.
Yeah, definitely.
So, the science supported it. And many clients eliminate their hot flashes, decreases their appetite, improves their energy, and helps with the libido and sex drive and function. So
okay.
I hated the taste, though, Tabatha. I could not drink it. And so, I grew up in a family of amazing cooks. So I started mixing it with other ingredients like the cat's claw, which is also from Peru. It's an herb that's a huge, powerful antioxidant, and a really good anti-cancer studies have been done on it, as well as, turmeric and quercetin, resveratrol, and grapeseed extract, and fruits that I experienced in different parts of the world, like mangosteen and acerola. And so started mixing it. And, again, that reversed my menopause, helped me lose extra weight, and also, regain my fertility. It all was part of it. Plus, I would say God's hand was in every step of the way. And
yeah, that's beautiful. That's amazing. And so do most women drink that, like put it in a drink and do it once a day?
Yeah.
On a regular basis?
Yeah, sometimes we need more, especially in higher stress times or if we're having a lot of hot flashes. You can go up to 3 or 4 a day easily, but 1 to 2 a day is perfect. Just mix it with water and drink it. I'm drinking it actually with hot water right now because it's cold. Hot water, and making it a tea, and it's just so relaxing. So I'll have that a couple times a day.
Oh, that is lovely. And you can get that on Dr. Cabeca's website if you're looking for that. I would highly recommend it. That's awesome. And going back to the diet for a minute, can you explain to my listeners why it's so important to be keto green?
one thing I really want to make a point about now is definitely the getting keto green opens up the pathways to have the healthiest life. It's honestly how we were designed to live out the rest of our life. So if we're over 35, over 40, or we're struggling with PMS, we're overweight, you definitely want to get keto green. And I always talk about metabolic flexibility because I like to think we're going to do some more fasting, but we're also going to have feasting.
Right.
Right? I believe in feasting. I'm a glutton at heart. I love my wine. I love my chocolate. I love to entertain and socialize. And so there's a time and a place, and it's part of having a healthy life. And so, in my books, I talk about the lab markers that we need to watch. And so that we are in control of our own health. So the point I really want to make is that do not give away the power over your own health, right? Like you and I are fabulous doctors. We are your girlfriend doctors, and we're going to talk and have the conversation. But yet, ultimately, each individual, everyone who's listening is in charge of their body, which has tremendous rejuvenative ability. And I want everyone listening to visualize and embrace their healthiest, most energetic, sexiest, passionate, loving self and really feel what that feels like. And do that on a daily basis because that just shifts our vibration, shifts our willpower, right? Shifts our physiology and empowers us to be in control of our own health. Don't give it, like I tell my clients, don't give me your power. I'll take 10%, but you're responsible for 90%.
Yeah, it's so true. Is you just have to be your advocate and reclaim your health. I have women who don't like their bodies and they are constantly saying things in their head, where all those negative thoughts, they just keep flowing. I said, you're not going to lose the weight. You're not going to feel better because you are telling yourself you're not going to. You have to change the conversation in your head. You have to change how you view yourself. As soon as you start loving yourself, the change will happen. It's a miraculous, beautiful thing, but it's true.
Yes. And I want to say one more thing is that, it does take more than hormones to fix your hormones, but hormones are essential as we get older. We know that if you don't treat osteopenia, it's going to become osteoporosis. We're going to continue to lose bone as we get older, and we take that for granted. Don't forget about the vagina. Will continue to atrophy if we stop estrogen, if we stop Jolva or using progesterone, DHA. I mean, we want to use it topically, and having a physician like you that will prescribe bioidentical progesterone, testosterone, DHEA, recommend Jolva, give opportunities for clients to be able to restore their vaginal and vulvar health in a very quick, beneficial way is just huge. So, yeah, kudos to you.
Yeah. Thank you
On the
for
forefront.
creating that product. It's amazing. Yeah. It's wonderful. I know you're always so full of wisdom. So, what else do you want my listeners to know?
We can't give up on ourselves. And that's what I see in my programs. I have my program, Magic Menopause, that really does span the decades. But what was interesting to me is that I found that women that were in my program that were over age 60 were over 99% international.
Oh,
But in
wow.
America, we're giving up on ourselves. So have
Yes.
we been told? Have we been drugged? Have we been, I mean, now we're neglecting ourselves. Like, first of all, every woman advocate for your vagina. We need it for the rest of our lives.
Yes. No.
We do not want to have any troubles there.
Yeah. We,
That's
in
correct,
the
right?
area that I practice, we've actually really been having an issue because when the pap smear guidelines changed, that had all of the primary care doctors telling women they didn't need pap smears anymore, which equals not going to the gynecologist. So that has been a real struggle in my area. Women thinking they don't ever need an exam again. And it's heartbreaking because then they're suffering, peeing their pants and being in pain and not being able to have intercourse. And they don't realize that there's help out there. And so that has done us a real disservice, and I've been trying to work on that big time.
Yep, I agree completely. Pelvic exams are essential and we can do so much. And also, we have to, again, treat preventatively, and then at any age, as we've seen with Jolva, we have clients in their 70s and 80s using it, we see improvements. So the body has an amazing capacity to heal, and we have to stand up for ourselves and not expect someone else to do it for us, whoever that someone else is.
Exactly. That's wonderful.
I agree with you that I think that, for women being told, oh, you don't need a pelvic exam, you don't need a pap smear, you don't need a pelvic exam. Really?
Yeah. And this is coming from our governing bodies, our, OBGYN association. So that's been frustrating, but all we can do is keep going to those conferences and letting them know, like, this is not best practice.
And as more, like our generation, my generation, we had more, like when I went to medical school, there were 15 women in a class.
Right.
Right? 15 women. And now they're 50-50. So as we've seen that increase of women that are entering the field of gynecology and obstetrics that are dealing with this themselves in medicine, we're going to start to see a shift. And I was shocked, though, that I wasn't seeing it already. I was shocked that my Emory colleague didn't have this in her armamentarium, wasn't aware of the research. Granted, you're busy, right? Granted, we're busy. But big pharma, I mean, there's a hold on what we're exposed to, and we're just so freaking busy in the clinics that and again, I would wish no one the journey I've been on to learn what I know.
Right. But thank you for sharing it. It's so important. I mean, I was stuck in conventional medicine as well until I had a back injury, and it wasn't until I was away from work for a good 4 months that I realized how broken it was, and that I really wasn't doing the best for my patients that I could be. And I'm so glad that I figured that out. But yeah, I wouldn't wish my journey on anyone else either. So all we can do is share our stories, right? And just help women advocate for themselves, and don't stop trying to feel better. If you don't like the answers you're getting, keep searching, keep looking, because people like Dr. Cabeca are out there.
Exactly, yeah. And I think with my first book, which is a bestseller, The Hormone Fix, I mean, for me, that's my magnus opus. Every woman should read that book, and the men who love them. I've had many men reading that book as well. And so in next book, Keto-Green 16, while it's quick and it really focuses on weight loss and certainly we're really pushing that intermittent fast, but there's all the science in there for this period to improve our neurology, right? To improve our cognition, to improve not just our physicality. We need to improve our, function. And so this is, I think it's groundbreaking, and we need to get it in our offices, the Keto-Green 16 program, into our corporations, into our Bible studies, into our small groups. We just need to start doing it as communities.
We do. And I would love to eventually see residency programs, and medical students really understand nutrition and all of this. So hopefully that will happen someday. So your book is coming out in May, is that correct?
Keto-Green 16 is out in May, but it's available for pre-order now everywhere books are sold.
Oh, that's wonderful. Okay, Keto-Green 16, so we can get it now. And then you told me a little snippet beforehand. There's something that is going to go along with it, the calculator.
Oh, yeah. So we have this great keto macro calculator with a personalized 3-day menu plan. So you get your own personalized menu plan, and calculate based on your some personal data like height, weight, lifestyle. We'll calculate out your macros and create a Keto-Green plan that you can start following right away.
Oh, that's awesome. Okay. And wonderful. And is that going to be sold on your website or other places?
It's a free opt-in, and so we'll give you a link to send people to.
Oh, neat. Awesome. Thank you so much.
Welcome. But right now, if they're just signed up, to my list at dranna.com, we will be emailing about that as soon as it's available.
Okay. Fabulous. Oh my gosh. You are just a wealth of knowledge. We could go on all day. This is amazing. I think my listeners got so much out of this today. So I definitely want them to check out the Hormone Fix and then your Keto-Green 16 when it comes out. I'll be the first one doing it. That's awesome.
Yay, thank
So,
you.
Thank you so much. This has been fabulous, and I hope we can talk again.
I look forward to it. Thanks for all you do.
All right. Thank you. Well, thank you for joining me today. I'm like totally geeking out that I got to interview my idol. So I hope that you got out of it as much as I did. I think that Dr. Cabeca is just a wealth of knowledge. So check her out on her website. And don't forget to follow me on Instagram and Facebook at Dr. Tabatha. I'd be super honored if you'd leave me a 5-star review on iTunes. It will let me know that what I'm doing is worth my time and that you're getting the information that you need. So shoot me your questions or comments. You can direct message me. I want to hear your feedback. Give me some ideas. Tell me what you want to listen to more of, okay? I'm here to support you. Thanks for letting me be your functional gynecologist. Have an awesome day.